my name is Allie, and this is going to be my video for providing catheter care for a female. In this video, we're going to pretend that this bottom part of my bed is a table because I don't have one that I can set on the side of her bed. So, hello, Mrs. Jones. My name is Allie, and I'm going to be your CNA today. Is right now a good time to do some catheter care for you? Yes? Okay. I would then pull the privacy curtain for my patient, and then I would leave the room to gather my supplies. So for my supplies, I would have a barrier towel for underneath my patient. I would have 2 washcloths, a drying cloth, a barrier towel for my table, 1 pair of gloves, some soap, and a basin. I would come back into the room, and I would lay down my barrier towel for the table. Alrighty, and then I could set everything down on top of that. Have my 2 washcloths, my drying cloth, my barrier for my patient. All right, my gloves and my soap. I am then going to take my basin into the bathroom to fill it with warm water. Okay, I'm going to use both hot and cold water. Alrighty, that feels good. So I'm going to fill my basin. Okay. I'm then going to go back into the room with my patient. Okay. All right, Mrs. Jones, would you like to feel the water to make sure it's good? Alrighty, thank you. And I will go and I will set my basin back onto my barrier towel. Then I will put on my gloves. Oop, there we go. All right. Or I'm sorry, before I put my gloves on, I would raise the bed to a comfortable working position. Then I would put my gloves on. Alrighty. The next thing that I would do is I would expose my patient by taking their blanket and exposing them just above the knee. Okay, and their gown just below their hips. Alrighty, and then the next thing I would do, let me make sure you can see, the next thing I would do is I would take my barrier towel for underneath my patient. Alrighty, Mrs. Jones, I'm going to roll you over on 3. 1, 2, 3. Okay. I'm going to tuck it under Mrs. Jones. Alrighty. I'm going to roll you back on 3. 1, 2, 3. Awesome. Alrighty. Now the next thing I'm going to do is I'm going to get my first washcloth. And I'm going to get it wet into here, right? And then I would wring the water out. I would have both hands to do this. And then I'm not actually going to use soap because I'm using pillows, but I would apply soap to my cloth and rub it in. I would back to my patient. Make sure you can see. All right, come back to my patient. And then I'm going to hold it at the meatus. I'm going to clean downwards. I'm going to switch surfaces and clean downwards. Okay, so this is my soap cloth that I just did. I will go put this back onto the barrier. The next thing I will do is I will take my second cloth and wet it with just water, no soap. I will wet that and wring it out. Okay, I will come back to my patient. I will hold it at the meatus and clean downwards. I would switch surfaces and clean downwards. I would then put this with my other towel on top of my barrier. Next, I would take my dry towel, hold it at the meatus, and dry downwards. And every time I do this, I'm making sure not to tug or pull on the catheter. Okay. Next thing I'm going to do is remove the barrier. Mrs. Jones, I'm going to roll you on 3. Ready? 1, 2, 3. Okay, and I'm going to pull out my barrier. I'm going to roll you back on 3. 1, 2, 3. Awesome. Okay, I'm going to wrap this up and put it onto my barrier. Okay. All right. Next thing I'm going to do is I'm going to cover my patient back up to her chest. Here you go, Mrs. Jones. All right, and after that, I'm going to take my basin into the bathroom. Okay. I'm going to dump it into the toilet. I'm going to rinse it. And I'm going to dump it. I would then take a paper towel and I would wash it all out, or dry it out. Okay. Then I would come back into the room and I would collect my soap and I would put these 2 items into the designated dirty area. The next thing I would do is gather my linens without letting them touch me, and I would dispose of these into the designated dirty linens. Okay. Next thing I'm going to do is remove my gloves without contaminating myself and throw those away. Then I'm going to wash my hands and do my ending steps. I'm going to lower the bed back down and make sure that the bed breaks are locked. I'm going to remove the privacy curtain and make sure that Mrs. Jones's call light is within her reach or in her hand. I would then wash my hands and that skill is completed.